Welcome everybody to this evening's event. It's a great pleasure to welcome you all. For those of you that don't know me, my name is Angus Dawson. I'm Professor of Bioethics here at CBmE. And with Nicola, one of our guests tonight, we have responsibility for developing health humanities here within the different schools related to health issues. So this particular event is hosted by CBmE, but it's a great pleasure to announce that we are moving towards creating a new unit, the Health Humanities Hub, so HHH, which will be situated within CBmE. This particular event is a launch event, and what we're trying to do here is to raise the profile of humanities within clinical health arena in general, and to encourage you to continue to help us to participate, to sort of promote the areas of activities in relation to humanities in general. Health Humanities Hub is a new focus to encourage students and staff to think about how humanities, the whole diverse range of humanities, and thinking about what humanities is one of the things that we want to focus on today. But the whole range of humanities can contribute to developing different aspects of the character, the careers, the nature of the clinical work that's actually done. What we want to do is to create and grow a community that is focused on these diverse range of activities that we're going to be calling the humanities. So the vision for the Health Humanities Hub is to strengthen humanism in the delivery of healthcare and the training of the next generation of healthcare practitioners. So occasionally we might lapse into talking about doctors or medical degrees, but that is because largely our funding comes from that particular area, but we really want to encourage us all to think about this as being something that applies across the health domain. So we want to encourage and develop contacts with students and staff in other schools as well, particularly those that we work with within the integrated curriculum of the first 2 years of the different programs. So our next big event to put in your diaries already will be a Health Humanities Festival, which we're hoping will be held on the 14th of November this year. And basically the festival will be an opportunity for all of you to manifest your different interests in relation to the humanities. There will be opportunities to present work that you've done, things that you're interested in, work that you want to do in future. And we will be advertising opportunities to bid for small amounts of funding to actually pursue humanities projects related to health. So hopefully you can see that we have a plan to build some momentum from this particular event towards the festival in November and then onwards into the future. But this is something that really is going to be a success due to the efforts of you all as students, members of staff, and taking these ideas forward. So I come to tonight's focus, which is upon this central question: why should clinical students study the humanities? And it's a great pleasure to welcome the members of our panel this evening. We have a distinguished panel, and what we're going to do is I'll invite each of them to talk a little bit about how they see humanities as being related to thinking about clinical education, care and practice, and then we will open things up and we can have a general discussion. You could ask some questions, or you can respectfully disagree with any members of the panel, and we can take things forward in different directions depending upon what it is that you're particularly interested in. So I'll just do some quick introductions of the panel and then ask each in turn. I might then ask some questions to see how they might respond in relation to different issues, and then we'll open it up for discussion. Okay, so our first guest is Professor Peter Singer. He's a renowned philosopher and bioethicist, and he is particularly, of course, approaching these issues from the perspective of philosophy and a career involved in producing work that's been incredibly influential, and he's also very well known for engaging in discussions of bioethical issues with the public. Our second guest is Associate Professor Nicola Ngiam, and she is a senior consultant in pediatrics and is a well-known figure, I'm sure, for most of the audience because of her educational role, the particular focus on communications skills, and she works very closely with us, and she's going to be playing a central role in relation to the Health Humanities Hub. Our third guest is Ann Toh. She's a medical practitioner and adjunct lecturer here, and again, you will know her. I'm sure everybody who's been educated here at NUS will have come across Ann, and she has a particular focus this evening on thinking about humanitarian and global health issues and how they relate to humanities issues. And it's a great pleasure to welcome Rajah Wong, who is a second-year medical student, and she in particular is going to be talking about the student perspective on these issues. But one of the reasons why we invited her here is that she also is very engaged with thinking about how music can make a difference within clinical education. Okay, so maybe I could begin by asking Peter to give his first thoughts, and then we'll take it from there.
So thanks very much for that introduction, and thanks to all of you for coming along. As Angus said, I'm particularly going to talk about the area of humanities that I've worked in for my entire career, and that is philosophy, and more specifically ethics. I think all of philosophy is interesting to think about, but it's ethics and perhaps as well political or social philosophy where philosophy really gets to make a difference to the way people live, to the way they act in many areas. And I want to very briefly make the case this evening for saying that if you really are to think about the ethical decisions that you are bound to face in a career in any of the health professions, having some understanding of ethics is really important. Now, you may get that, you may be taking courses in whichever the professions you're in. You know, certainly medical students often get courses in medical ethics, nursing students may get courses in nursing ethics. But I think it's clearly important to have a little more background than just knowing what you need to know in one of those courses to pass the exams and get on with your degree. Because I think that ethics really asks basic questions about how we ought to live. If you go back to the ancient Greeks at the start of the Western ethical tradition, you find Socrates saying that you know what we're talking about, he says in the dialogues, at least as Plato presents them, is no trivial matter, but the question of how we are to live. And I think that's really right. I think all of you, relatively young audience, have lives in front of you. You've no doubt made some decisions that you're here, you're at university, you're involved in the health field, but there'll still be many more specialized decisions that you will be making. And so the question is, how are you going to think about those decisions? Now, a lot of you, if you go for careers counseling, perhaps at high school you went into some careers counseling, a lot of that is basically, well, you know, what do you like doing? What interests you? What is your passion? What skills or abilities do you have? But another question that doesn't get asked enough, I think, is what are your most important values, and are you going to be able to find something that you do that is both satisfying for you and suited to your skills, but also is advancing your values? So to answer that kind of question, and to answer at least in a thoughtful way, you need to think about values and about what values should I be holding, and of the various options open to me, which of them is likely to have the most positive impact, not just for me, I hope you'll be thinking, not just for me, not even just for my family or my friends, but for the world as a whole. And obviously, those are questions where ethics is very relevant. What would be a better world? Those questions have value judgments behind them, the kind of world that I want to see. What are the priorities that I have? One of the things that you're likely to be able to do in the health professions may be to reduce suffering or to extend life where it would not have otherwise lived as long. And you need to think about the importance of that. You need to think about for whom is that important. I just heard, Anne, that you're going to be talking about global and humanitarian issues, and I think that's a question that we all ought to be thinking about. It's very often the case that if you're living in an affluent society, as Singapore is, the cost of doing something that will benefit people health-wise, will save their lives or will help them to overcome very serious illnesses, is much higher than the cost would be in low-income countries where there is very little health care, where the standards of health care are very low. So you might think about that as an ethical question. Should I be thinking about doing the most good that I can, and will that be in an affluent society, or will it be, for at least some of my career and some of my work, trying to help people who, because they are much lower at the level of the health care that they can get access to, will benefit more by some additional expertise, some additional knowledge. I think those are clearly important questions. There are also questions that you'll be faced inevitably with new technology coming along in the health areas. I'm old enough to remember when in vitro fertilization was first developed. It was in the 1970s. In fact, it was related to the fact that I moved into bioethics because there was a lot of public discussion about this question. Some people thought that it's wrong to fertilize an egg outside the human body, that this creates some risks. Some people thought that it's damaging to the, as they regarded it, the sacred status of the embryo, to have it in a glass dish or subsequently even to freeze it. And that the fact that many embryos would be lost and would not fertilize was an ethical reason against doing this. And then there were other concerns as well about possible future developments that would arise from this, some of which we've seen, like the use of surrogates to carry a pregnancy for a woman who cannot carry a pregnancy, and some of which we're only just starting to see, like the use of genetic selection to avoid genetic diseases that a couple might be carrying. That is something we are seeing, but potentially, obviously, also we can do this to produce positive aspects. Perhaps some people are talking about selecting for particularly healthy embryos rather than simply ones that will avoid diseases, or selecting for ones that will have certain abilities. Maybe will have a better chance of getting into a top university like NUS. So those ethical questions will undoubtedly increase over the coming years, and I imagine some of you will be faced with them. There's also questions about the technologies we have for prolonging life. We can prolong life in many circumstances where we could not have prolonged it, say 50 years ago. But is that always a good thing? Do we want to prolong the lives of people in persistent vegetative states if there is only a vanishingly small chance that they will ever recover consciousness? So those are also ethical questions that invite you to think deeply about what your fundamental and underlying values are. So I think that's why it's really important that you think about ethics, that you try to have the deepest understanding of that you read some of the works. There are certainly plenty of fairly popular works written in ethics, and there are more serious works, but you'll find what interests you, and that you feel that you really have a solid background in ethics that will guide you and help you to make important decisions throughout your life. Thank you.
Thank you very much. Maybe I could take you up on thinking a little bit about that question to do with values, and then the different topics that you've outlined there. They're all things for us to think about and discuss within the classroom, which we do. Do you see philosophy as maybe imparting, or using philosophical methods as imparting a set of skills as well that could be useful for the aspiring clinician?
Yes, absolutely. Philosophy does help you to develop your skills of reasoning and argument. And I think it's really important to understand that you shouldn't think of philosophy as learning facts about what Plato or Aristotle or Kant or Leibniz or Descartes or for that matter, Confucius or Mencius or whoever else it might be, what they said. It should rather be a development of your skills in thinking about the questions that those philosophers of the past raised, and particularly those that are still relevant today, as I said, as many of them are. So those skills in reasoning and argument are going to be valuable in other areas as well. There have been some studies that have shown, in fact, that teaching philosophy to school children, even at quite early ages, can help them with their learning and their application to other subjects as well. So I think what you get from philosophy is a general way of thinking and way of learning to distinguish sound arguments from fallacies that is going to be useful in many other areas.
Great, thank you. Okay, could I invite Nicola to give a few reflections?
So I'm just going to share a little bit. I'm going to tell you the story of how I got into health humanities, maybe, because that could be interesting for younger people. And then I'm going to talk a little bit about narrative medicine, which is really the area that got me interested in health humanities, and then tell you a bit about the impact it's had on me as a clinician. So the story goes, it's serendipity, I think. Okay, so I attended a conference that was completely unrelated to health humanities. It was related to standardized patients. So those of you who know me probably know that I work with standardized patients quite a lot. So I went to a conference and somebody was running a workshop on narrative medicine. And I couldn't attend it because it was competing with some other session. And so I asked the person, can it be recorded so that I can watch it later? And the facilitator said, absolutely not. And so I thought, okay. But then he went on to explain it to me. And I think it is a space in which people get to share their reflections. There is different opinions can be brought up, and it's a safe space, basically, and confidentiality is maintained. So those were the principles of that space, and therefore it could not be recorded. So I understood that. But what then happened was this very kind man who was the facilitator. His name is Tony Ericetti, and his fellow facilitator, who's Ginny Durder from New York, basically offered to train us at NUS. Not a couple, but about 6 or 7 of us, faculty from NUS, in the process of narrative medicine, essentially. So we were really, really lucky to have met this man and lady who were very kind to take us through that process and actually help us through many sessions and kind of handhold us as we felt our way or learnt our way through narrative medicine. COVID also happened, and so we were again lucky to be able to attend a workshop on narrative medicine where it was born, basically from Columbia University in New York, and we could attend it virtually. So it was an excellent opportunity. We had to be all night. I think Anne was there too, because of the time difference. But really, we didn't have to travel. We could do it from the comfort of our own homes, and so that was really convenient. So I think that's how we got into it. So I guess for the younger ones, curiosity or experiencing new things might lead you in directions that you may not expect. Yeah, so I did not expect to land up in health humanities, but that's how I got here. So narrative medicine, what is that really? So narrative medicine is medicine that is practiced with narrative competence. Narrative competence is the ability to recognize, interpret, and be moved to action by patient stories. Yeah, so I think stories have always resonated with me. I learn best when somebody tells me a story. And you learn a lot about your patient by listening to their story, other than their medical, pathological problems. So I found that very, it drew me, it resonated a lot with me, and therefore this was an area that I chose to explore. The 3 pillars of narrative medicine are attention. So it's really close listening. So listening attentively and actively. And that's what the narrative medicine process trains you to do, trains you to listen, really. The next pillar is representation. So I think we, through narrative medicine, can appreciate different perspectives through the art pieces that we use, essentially, be it a poem, be it a short story, be it film, be it dance, be it art, essentially. So we're trying to figure out what the person who created that piece is trying to say. It may not be the right thing. It may not be what they're actually trying to say. But listening to the people in the room, it really helps with that exchange of ideas. I think representation also comes through writing. So we do a lot of writing during these sessions, and it helps you to translate your thoughts or your interpretations into a written form. So you get to represent, essentially, your own story in a sense. And then the last pillar is affiliation. So I think through listening and interacting with other individuals during the session, you really build empathetic connections. And that's the crux of a patient-doctor relationship, I think. So being able to connect with other people, I think, is a really important skill, and I've learned to hone that through narrative medicine. Yeah, so that's in a nutshell what narrative medicine is, and how it's impacted me as a clinician. It's done all of that, basically. I've become more open to other perspectives. I listen a bit better, I think. I'm more open-minded. I stop myself from judging too quickly. And so I think these are all skills that I've learned through participating in narrative medicine sessions. It's also become part of my self-care. So I really look forward to the narrative medicine sessions that we run. So we do this once a month as a group. It's a community of practice that has developed over the last few years. And that's really an area or a time where it's set aside for me so that I can engage in something that I find meaningful. So it's, part of my self-care as well. Yeah.
Thank you very much. So how do you see the technical side of medicine relating to that more narrative medicine side of things? Do you think it changes the way that you see the technical side of things, or is it something that you add on to the technical side?
Yeah, I think what I've noticed is in Singapore, we all come through the generally science stream to get into medical school. I speak for medical students or doctors. And our mind is trained to look for solutions, essentially. So that sometimes is not so great when we interact with patients, because all we want to do is find a solution for the patient. When most of the, or a lot of the time, they just want us to listen to what their experience is like and how they're processing their illness, or maybe dealing with their suffering. So I think it has opened my ability to appreciate the biopsychosocial model of care, I think, which is really important. And I think many of these aspects, other than the biomedical, have an impact on the control of illness, and in fact, compliance with management, or rather adherence now, yes, adherence with management. And so it's very important to be able to distill that from the patient and figure out what is important to them, or what their values are really, and how to help them, or walk with them in that journey through illness. Yeah.
And do you think there are special issues that come up in pediatrics?
In terms of the biopsychosocial model?
Or just narrative medicine. So thinking about, does that mean that when you have a very young patient,
right,
who is a child, maybe there's less opportunity to listen to their stories?
Absolutely.
You're listening to the parents' stories, so you
Yes.
have other parties involved, and you might get different stories being told about the same thing.
Yeah, absolutely. So I think in children, we have to be reminded to listen to the child's voice. And they tell stories in different ways. And sometimes when they're very young, it's hard to understand their perspective. So maybe this is a way to use stories or storybooks to try and, understand them a little bit better. Yeah, but not moved into that area yet. But an interesting concept, to consider.
Okay,
Yeah.
Thank you. Dr. Ann, you're up next. So thank you. Could I invite you to give a few reflections?
Thank you. I think I learned a lot from the sharing of Prof. Singer and Prof. Nicola. I think I like that the theme of values was brought up. I think when I was a medical student, like some of the students here, I'm not so young anymore, so it might be difficult for you to imagine me as a first-year medical student. But I think it's very simple. We are trying to learn what I felt like as a student from a young person's perspective. I want to do good. And then I go out into the world and I see more suffering. And there are all these problems that people have, and we're supposed to learn the clinical skills and how do we solve them. And then when I become a doctor, I realized that a lot of the solutions that are in the textbook are not quite accepted by my patients, especially when I start working in a home care setting, because that's where you wonder, why are there boxes of this medication here? Because if the patient has been taking it every day, then the medicine will be used up, but then they will confess to you sheepishly that they do not subscribe to that narrative of what's happening to the body, and they're not convinced that this is the right treatment for them. Then I started to become more interested to then where is that gap between what we want to do good and bring to the table, and how come the outcome is not being actualized from the human experience? Is it a problem of the treatment is not effective or correct? But then from a clinical training perspective, that's what we check back the textbook and the literature, and no, this is the antibiotic that is supposed to be. Then I started to realize that maybe is there a communication gap between us as practitioners who treat with whatever we have in our toolkit, whether it's medication and doses and investigations, and what the patient really wants. And then, then coming to Prof. Nicola's sharing about narratives, then I would say that I very subtly went into narrative medicine unknowingly through poetry and art. I think some of the children taught me, because I was thinking, sometimes in the home, I'm thinking, what is this obsession about Elsa and Frozen? I can't get it, right? Like 10 years old, Elsa, Frozen, like every day is singing the same song. And I started asking myself, like, why does the child like it so much? Like, what is it about Elsa's story in Frozen that resonates with this 10-year-old child's experience of illness? And then I started to ask myself, so is there sometimes I did find when I was doing children's palliative care that not everybody in the family, in a conversation, in a family setting, a family meeting, has an option to have a voice or to articulate their wishes freely. There's so many layers of that. And in some settings, sometimes the children don't have an opportunity to say what they want. And I'm just asking myself, is there a deeper story? Is there a listening that can be had not through spoken word? What if they can't articulate it? And are they telling us something through actions or through, like by not taking the medication, the patient is telling me that this is not okay for them, or something has fallen through in the communication or with the patient. And then I started to think like, then if I am a home care doctor, I'm entering into a patient's house. Is listening maybe more than what is spoken? What does the environment tell me? Is this patient cared for? Is the cognition intact? What is important to this patient? And then maybe listening is not just the words then, but am I entering into somebody's story? Then I started to realize maybe later on that sometimes when I enter into that story, it's a very complex, intangible ecosystem. Are there things that I can do or say that actually create more harm? Because I think my context is a bit different because I enter into the homes, right? Like, can I potentially create more harm? Maybe putting it very directly. So for example, if I transform the home environment and the patient's room into a hospital ward or an ICU unit, does it create harm or does it bring benefit? And what does the child or the caregiver really want? Then I realized that I don't really listen very well with my eyes or with my ears or with my mind or with my heart. Then how can I deepen into really listening? Then when I went into the humanitarian context, I realized that we all didn't quite understand each other what we wanted. I think like some of our students here, like Ying and Xiang Ling, I did like quite a lot of community involvement projects overseas. But when I had a more formal role as a doctor, we asked ourselves after 2 years of teaching in Timor that we're not quite sure our learners are actually learning what they need and are they really understanding what we are teaching them. And we had to go back to the drawing board and really realize that we need to, so just like when I enter the patient's home, I need to listen deeply to the story of this environment and the unspoken and the everything that happens. What does this tell me of the narrative of the patient? When I enter into a country, what can I understand about the narrative of who they are as a people? And then when I was doing a little bit of work with my friends from Ukraine, I think that they taught me that very, very clearly. Because in the middle of the war, what they actually told me is that their elders in the family started taking out, these are cultural narratives. Their songs came about very strongly. The motifs that depict the symbolism of the stories that they grew up with. One of my friend's mother, she's a doctor actually, she's still in Kyiv, started taking clothing of the relatives and the family members and started stitching it together as a quilt. And for me, that came across to me as a very interesting narrative. So when the war is happening, what is happening to, that they taught me that as a people, we stand together and we stand firm in who we are and understand ourselves to be. And it was a healthcare related project about mental health, but it helped me to realize that health is so complex. Health in itself as a story is very complex. And unless I try to every day try to enter into the deep depth of that complexity, I may get outcomes that the donors, and philanthropic organizations may be very happy with in terms of statistics, but are these really the outcomes that are happening to people on the ground? Is culture being wiped out? So recently I went into another place to do teaching and I asked myself, like, who are these people as, what do they envision their health to be? What is their story? And I saw in the streets and when I was trying to listen to that, a lot of imagery and things from other countries, other cultures, other languages that are not indigenous to them. And I started asking myself, then what happens to that, right? Like, not every country might be as express themselves as strongly as like my Ukrainian friends. Like, no, this is, we're going to, we ran a conference together, global health conference, and they said, no, we are going to do this the Ukrainian way, and this is how we're going to do it, and we're going to MC it, and this is what's going to happen. We're going to educate everybody about our culture. But not all, and especially some Asian cultures, they're a little bit more indirect in our communication. Then I started to ask myself, then when public health comes out, when more interventions come in from overseas, do we do good in terms of the concept of health as a whole? Is there potential harm? And is culture and the understanding of health to them as a people being wiped out? So that is my response to Prof. Singer and Prof. Nicola.
Okay, thank you. And I think one of the things that's coming out there is thinking about a respect for the places that you're working, different kinds of traditions and so on. So different kinds of values, and how you, as somebody who is in that kind of situation, how you respond. So we have our, we can think about geography maybe as something that is added to the humanities that we've heard about so far. So thinking about philosophy, thinking about narrative, thinking about geography. I don't know whether you have any thoughts about thinking about being somewhere else and how that changes you as a doctor, and how that might be important in relation to these activities, as well as the danger of bringing benefit but also potentially harm in the situation which you face.
So I think what Prof. Singer talked about, ethics and humanitarian work. I was recently, so there was a health system crisis in the news and everything in Timor. There was no medication in the community. I think hospital, they were serving 1 tablet of paracetamol as analgesia for a patient with post-op, like a forefoot amputation, because they were rationing the medication. So medication was really very short, and we had to really ask ourselves, if we do something, what are the harms? What are the benefits? What is the bigger picture of things, right? So, and even zooming out from a broader perspective, how do you deal with justice in that setting? So I had a colleague who I met, he's back in New Zealand now, but he was working in the air ambulance, the Medi-Evac. And in the plane, there was only 1 set of oxygen tank and the respiratory support systems. But he had to evacuate a pair of twins. And he was very distressed by that, because then how do I choose which twin to give the respiratory support to? And so I think that I started thinking very hard about ethics and such things, because the questions, when I go there, every day the questions come up to me. And people, some people say, like, then maybe it's better not to do anything, because by doing something and starting something might be cause more harm. So I think that there are a lot of these things that I'm still chewing on. Yeah.
I think you brought up a really important issue there, which is about the potential distress of clinicians, and how maybe we can think a little bit about how humanities might help in terms of providing the support or the character development to actually help within very stressful situations which different clinicians might face. I don't know, what do you think? Is that?
So when I must say that when I do some of this work, even reading some news and knowing about on the front line what is really happening, it's quite distressing on an emotional level. But I have seen so much strength. So there's a poem in Tattoon in the museum. Not supposed to take a photo of it, but I took a photo of it because it was so fantastic, about not giving up. This is indigenous to them and written in their own poetry about, we will not give up our country, our identity, our people. And then I think that gives me, how to say, I think when on a distress level, and when there is like small t and big T trauma, people don't listen so well to some people don't listen so well to words, like theory. But when it comes through symbolism, I think it really hits home. It hits a different level. And I think that is probably what I've learned a lot from the people who have gone through so much suffering from there. So if they are not giving up, and I'm back home in Singapore, and only there for a short period of time, there's so much I can learn from their resilience and I did ask myself, as a Singaporean person, I think we are Straits-born Chinese. If anything come and take our country, like it's a dot on a map, what are we going to do, right? I think we're all going to migrate overseas. And I learned from that, the courage and the resilience and the pride and people just keep on. So I had a friend he runs a rural care service. It's somewhat similar to what I work in Singapore. It's a home village and home care doctor. He goes out into very, very rural areas, sometimes by horseback. They walk 19 hours one day too. And then when there was no more medication, I asked him, what are you going to do? He said that the people still need hope. With whatever he can bring, even if it's just gauze, he will still go. And so I would say that all this, it makes me, like in a mindfulness concept, there's a beginner's mind. Every time I hear all these stories and hear the narrative hits home through the humanities, it really helps me to feel like while I'm in that space originally intending to do good and serve, I'm actually really here learning a lot from them, and that's a great privilege to come alongside. Yeah.
Thank you.
I'm a poet, so I may not always. You might have to interpret it, symbolically. What am I saying to you? The doctors don't always understand what am I saying.
Hello, I'm Rianne. Maybe I'll start by just sharing on like how I found my way to medicine. So maybe it's a bit of like a backstory. I was actually from like School of the Arts. So I studied there as like a voice major. And then I guess like in like Sec 4, I was like, okay, I think I'm interested in the sciences. And I considered things like research and stuff like that. And then after that, I know I had friends around me. They were like, do you really want to do medicine? Like, what is the link between like studying in SOTA and then pursuing medicine? So these are questions that made me think a lot. And in that whole period of time, I was asking myself constantly, like, is there a link? And in the process of thinking about, is there a link, I realized that there is a link. And because I realized that medicine is an art, I know that we all see it as like a science, is like anatomy, physiology, but I realized that underpinning all of like medicine is really humans. And that's where like I feel humanistic medicine comes in. And that's where like I started getting very interested in like actually pursuing medicine coming from like an art school and a music school. Yeah. And maybe just to share about like one turning point, I guess, that made me decide that medicine was something that I wanted was actually that I was performing for one of these concerts, raising funds for patients with muscular dystrophy. And then at that moment, I realized how much of a tangible impact the music had on them. Like I watched how like, they were struggling because the muscular atrophy and stuff like that. And it really pained me to see the pain they're going through. But I realized and I watched how the music like spoke to them. Like you could actually like visibly see them begin to smile as like we sang for them. And that really like made me very, very happy. Yeah. So maybe now just to share a bit more on how I see music in medicine itself. Like for one, music can be used as complementary and alternative medicine. I know that music can be used as music therapy. So I used to actually go down to RCC hospice where we actually sing for the patients there. We actually engage them. So we get them in a circle. Be like, uncle, can you play this rhythm for me? Can you do these breathing exercises to help? It also helps with things like dementia, Parkinson's, stroke as well, speech therapy. And I think it really just amazes me still up to like today that like music has such a profound effect on people. It's not just something that's so theoretical that like I learn this rhythm, I sing this piece. But I feel music for me has really given me a greater like insight into what it means to understand the patient as a human being. And so apart from music as like music therapy and things, music has also given me an outlet. Like since young, music has been this space where I will go to, and this thing that I can just go back to. Like when I'm stressed and stuff like that, I'll just be like, okay, I'm gonna sing. I'm gonna write a piece of music. And I think up till today, even during clinicals, to go around, you see patients. Sometimes music does help me process some of the suffering that I see the patients go through. Yeah. And there was this thing that I thought about as well on like how has music given me, how has music helped me in becoming, or in my medical studies now? I mean, I thought about, has it actually given me any tangible skills that can help me now? And I think for one, active listening would be something quite big. So currently I'm singing with choirs and the SSO, and through those rehearsals, I actually begin to think, I'm like, does this actually help me in medical studies? I'm spending so much time like singing and stuff. Does it really help me? And I think, you know, in the choir, you think of like soprano, alto, tenor, bass, and you realize you have to listen to each of these parts so clearly. And not just listen to like the pitches and the rhythms, but you gotta listen to like the color of their voices. You gotta listen to the orchestra and like each of the timbres that like come out from that. And for that, it made me think that it actually helps me listen to patient conversations better in terms of like the subtleties of what they say. So maybe as like an example, 2 weeks ago, my clinical group and I, we went to NUH for a clinical posting. And one of the patients there, they were just sharing on their condition, because we asked them, you know, the history taking, the 9 boxes and everything. Yeah. And then the patient was a bit reserved, and they wasn't really telling us much. We just know there was a bit of issues with the kidney and stuff. And then I asked, like, do you have any previous medical conditions? And then the patient was like, yeah, diabetes, but I mean, it's under control. I've been taking medications and everything. And we were very tempted to move on to the next question because like, we had like the 9 boxes. But then I felt that the patient kind of like pulled back a bit when I said, is your diabetes under control? Like you could sense this like, yeah, I'm taking medication, but. So then my CJ and I, we decided to pick up on that. And I'm really glad we did, because we realized that actually the kidney was like not functioning properly because the diabetes had progressed. But because the patient was also like, I guess a bit reserved in terms of like, was my diabetes really under control and things like, was she really compliant? So music has given me a little bit more insight into really understanding like the patient subtleties in terms of when they speak. When they pause over certain words, I'm like, oh, is that something that concerned you? And that's something that I can pick up on, and it's helped with history taking lah. And something else that music has helped me with is also in realizing how important like the doctor-patient relationship is. Shadowing like doctors in a hospital, I realized that what really stands out to me is that when the patient says, I really trust you as my doctor, you can really see like that connection between them. And I realized that all of this was from the doctor genuinely listening to the patient and seeing the patient as so much more than the condition. Because sometimes when, I guess we study so much, you know, we realize we get lost in like the books and we get lost in like the physiology. But I think being able to dig deeper into that, like what brings you in here? Why are you here? And something that I read about actually like 2 days ago was that what drives a patient to come in to see the doctor is because they're suffering. Like there is the pathophysiology behind like the disease that brings them in, but it's the feeling of pain that brings them in. And I think that's something that really resonated with me, because I realized that music gives me a deeper insight into the pain that they're facing, helps me to connect a bit more with them. Yeah. And I think knowing that like the humanities is something that is so big and I feel really should underpin a lot of like medicine. I think I'm really blessed as well that I have a group of friends in school. Like we actually have the Medical Humanities Collective here in school, started by like our seniors here. And we explore like different issues on philosophy, poetry, anthropology, and so much more. And it's really nice to just have this space where medical students can talk and just share ideas on the humanities.
Okay, well, thank you so much. I think one of the things that really comes through there is how humanities might benefit you as a student and as a future clinician on a personal basis with just dealing with the situations that you face, as well as potentially allowing you to understand patients more and therefore deliver potentially better care. So I think it's interesting, and maybe that's one of the things that we can pick up on in the general discussion, is thinking about the different ways that different aspects of humanities might actually be be beneficial to the participants. Do you think there's anything different about music as opposed to some of the other humanities? Because you've been very eloquent about how music helps you, but some of these people out here, they'll be tuneless. You know, we wouldn't want to hear them singing. They might have no sense of artistic expression at all. So how do we encourage people that don't have already the sort of musical perspective that you have to develop the sensitivity to the interactions with patients, for example?
I think, yeah, the different forms of humanities that, like, for example, we in the MedHums Collective talk about, I feel like they all offer different perspectives into helping us better understand how to be better clinicians. So, for example, tomorrow I think there's a talk on like poetry in medicine, and I realize like things like history of medicine, where you understand like the meaning behind like why there was a disease, what started the disease, the origins of all of these things. It does, I think, all of the humanities actually. It encompasses a very softer side of medicine, which is very, very interesting and very special to hold, I feel. But each of these like different forms of the humanities offers a different way you get there. So for music, for me, as I shared, it's like actually singing and having like these skills that brings me there. Maybe for narrative medicine, it would be listening to like the patient's stories, and I'm sure Prof. Ngiam, yeah, on what she shared about narrative medicine as well. So it's all like different forms of how we can get there. And I think it's very interesting to see how there's so many different skills from each of these disciplines that you can go into and bring to medicine. Yeah.
Okay, thank you. So a question to everybody would be, we're all here in Singapore, and how do you think that a Singaporean perspective on the humanities might make a difference to some of these questions? Do you think it is important to involve local culture, attitudes, beliefs, and so on? And how might we do that? What might be the benefits of doing that?
Hearing the stories of patients, I found that if asked for a religion, most people would put down something, even if they didn't practice it. It might be a religion that they grow up. So recently I got a patient who, I think is Taoist. She's a medium, you know. And she started shaking in front of me. So I was thinking, this is a seizure, you know. And I was thinking of my diazepam to abort the seizure and what is happening. And is this a real seizure or is it a myoclonus or what? And she told me that she doesn't really want to talk to doctors because she cannot tell doctors about what she really believes about why her shaking is due to. It's because the negative entities. Okay, sorry, the story is culturally is very. So I asked myself as a Singaporean, how come I didn't know so many of these stories? But with my native medicine skills, I could be open and humble and curious. But basically, we as doctors and nurses bring along with us quite a lot of spirits and negative entities, followed the patient to the home and caused that. Then I said, so sorry about that we brought it. She said, doctor, she said all this in Mandarin, you can't help it, you are a doctor, all doctors will bring some with them. But my body is weak now because of the cancer, so I'm more susceptible to these entities. So I was thinking, for her at this stage of her journey to understand my worldview about cancer and terminal cancer and what to expect in the next 2 to 3 months may not be serving her. But can I understand from her perspective about why she thinks she has this illness? Why she doesn't want to go back to hospital? Then when she really starts dying, what kind of care can I render in the home that is acceptable to her in her worldview? And so like a very simple example, it might sound to be quite unusual, but it's very serious. We go to the patient's house and you see a chair, it's quite grand and special chair and Taoist home. Please don't just sit there on the chair. No, one doctor sat on the chair. She was so upset because if the chair is a medium chair, they sit on the chair to channel like the spirits lah, no? Different type of mediumship, Guan Yin, to tell you the wisdom. Okay, but it also impacts on how I talk to her as a doctor because she was trying to channel Guan Yin to tell me about my life and some advice to me about my career in the next 2 to 3 years. And I want to ask myself then, how do I act in that space that would serve her? but if I immediately take out the diazepam, she already hinted to me in a very roundabout way, in a very indirect Chinese way, that your medicine doesn't work. Last time the doctor tried to give it behind, but the shaking continued, and this is nothing to do with your medicine. But you see, but what she say is that actually she is refusing healthcare teams. She refused to go back to hospitals. She refused to go back to clinical settings because she feels that people will look at her in a judgmental way and feel that her story is very strange. But I was thinking to myself, then are there many people out there who might feel that way, and then they just don't show up, and we don't have the opportunity to help them. But I must say, in that home visit, because I come from a different upbringing as her, so it's quite new to me about doctors bringing entities. So I also had to ask myself, then how am I trying to process this, and how does it intersect with my technical understanding of metastatic breast cancer, and then how do I then respond in a way that will really help her, like comfort her or help her in some way, not in the way that I think it will help and I can just check a checklist on my medication sheet to say I've done it. Then she will really tell, because she said like, don't come back anymore. No, she said to some, don't come back anymore because your worldview is too different from mine. So I think as a home care doctor, I see this is one example. It sounds quite dramatic, but actually there are a lot of such stories that I hear. And I told her, no, thank you for sharing this with me, because probably a lot of my patients, especially the elderly patients, feel that way. But, in front of the doctor, they did not dare to say it or want to say it about what do they really think about the medications, the illness, and the beliefs. Yeah. So we must understand I feel like we must understand where our patients are coming from, and the cultural perspectives that the poems, the art, the songs can give us a hint as to what their worldview looks like.
Yeah, thank you. Anybody else want to say anything, add anything on that particular issue? Thinking about the local.
Yeah, thank you, Anne, for that really insightful story. I think switching gears a little bit, I guess, from the narrative medicine perspective, as a group, we have kind of explored more local pieces, so local poetry, local art, essentially. So it's quite a rich, I've never known this before until we started exploring. So there's really quite a lot of material out there that is can be used or we can engage with, essentially, to help with our understanding of local culture. So I think it's the effort to just go and look for it. The tendency is to go for the easy, common, famous writings or literature, but perhaps we just need to do a little bit more, investigating of other forms. Yeah.
Okay, thank you. Any other thoughts? I guess there is a philosophical aspect to this, though, which again goes back to where you started with this idea about values, because a question that you would often get, I'm sure you'll have dealt with this many times in your career dealing with members of the public, is people often say, oh, well, people have all kinds of different values, and how do we actually take that into account, and should we always listen to all of the different values that people have? So maybe it's important to understand the perspective that somebody's coming from, but surely there must be a set of values which we can teach in medical schools and other health disciplines, and then the clinicians can go out and just apply them.
Well, having heard about the narrative of Kant and the story of the entirely different worldviews about what causes disease, I'm certainly not going to say we just have to apply our values and ignore the values of the patients or the community we're working in a whole. I think we certainly should listen to those values and try to understand what they think about them. But and I think we will often find common ground. In fact, it's not the case that every different culture has a distinct and different set of values. There's an enormous amount of overlap, and I think part of that is because we're an evolved species that has had similar sorts of selection mechanisms that have led us to being here. So, for example, we have strong family bonds that's universal. We're mammals, that's the kind of species we are. We also have infants who need adult care for a long time. So that relates to the way we feel about our children and our families. We also benefit from cooperative relationships, and clearly an advantage for us in surviving and managing. And there's a lot of recent work just in terms of actually improving health. One of the bigger factors in terms of predicting how long people are going to live, in the absence of fatal diseases, of course, is, are they in relationships? And that adds significantly to your life expectancy if you're in a relationship, which doesn't mean necessarily just with one partner. It might be that you have a lot of friends, but those sorts of things are important. And those things, I think, are really universal. But we also can find common values in, I talked about healthcare professions relieving suffering. So nobody really wants to suffer. Sometimes some cultures may say, suffering is good for character, so you have to, I don't know, go and have ice baths or plunge into the icy lake if you're a Finn, for example, or whatever else it might be. But the suffering itself is not considered a good thing, and obviously the suffering from illnesses really nobody wants. And on the other hand, we have common pleasures, common joys in life, again often related to relationships and friends, and certain experiences. So I think there are a lot of common values, and I think in whatever community we're in, we can try to stress those common values. But sometimes values will certainly get in the way, just as I think in Ann's case, the worldview of the patient got in the way. If she didn't want to see the doctor again, clearly that's going to likely to reduce her life expectancy. And sometimes they may be values, they may be religious beliefs. Say, God doesn't, Jehovah's Witnesses, for example, may say God doesn't, forbids us to have blood transfusions, and they may die, or their children may die. Many countries now have laws that, in fact, you're allowed to give a blood transfusion to a child, even if the parents refuse, but with adults they may refuse. So you can't always find the common ground that will promote health and increase life expectancy. But I think very often you can. And you should always try to work within that common ground and bring people to share the values that one's about, as I say, reducing suffering, enjoying life, being positive, contributing to society. I think most cultures have those values.
Yeah, thank you. So we'll move into the second phase now, but would you all be willing to join me in thanking our panel so much for their thoughts?